What if the burning sensation in your chest, the constant need to clear your throat, and that mysterious lump you feel every time you swallow are not separate problems at all, but one single issue that most people never trace back to its real origin? That question alone should make you pause, because millions of people are living with chronic mucus in their throat, persistent coughing, and that uncomfortable feeling of something being stuck, and they are treating each symptom individually without ever asking why those symptoms exist in the first place. The medical system, as well-intentioned as it is, tends to classify conditions based on their symptoms rather than their causes. A symptom gets a name, the name gets treated like a disease, and a medication gets prescribed to suppress what the body is actually trying to communicate. But what if you approached this differently? What if instead of thinking like a patient waiting for a diagnosis, you thought like an engineer trying to trace a malfunction back to its source? When someone experiences chronic mucus production in the throat, it rarely shows up alone. It brings company. Postnasal drip is one of the most common companions. That slow, irritating trickle that makes you constantly sniff or swallow. Then there is the coughing, which tends to be worse at night than during the day, and there is a very specific reason for that timing, which will become clear shortly. Hoarseness creeps in, making the voice sound rough or scratchy even when no cold or infection is present. Some people describe a sensation like a lump sitting in the throat, something they cannot swallow away no matter how many times they try. Others experience a sore throat that lingers for weeks without any sign of a virus or bacteria causing it. Taken individually, each of these symptoms might seem unrelated. But when you lay them all out together and start looking for a common thread, a pattern begins to emerge. That pattern points toward two specific conditions that most people have heard of, but rarely understand at a root level. The first condition is gastroesophageal reflux disease, commonly known as GERD. The second is laryngopharyngeal reflux, known as LPR. Both involve a valve at the top of the stomach that fails to close properly, allowing acid to travel upward through the esophagus. The difference between the two comes down to how far that acid travels. With GERD, the acid rises into the esophagus and causes the familiar burning sensation known as heartburn. With LPR, the acid travels even higher, reaching the vocal cords and the back of the throat. This is why LPR often produces hoarseness, a metallic taste in the mouth, and intense throat irritation, even when heartburn itself is not present. With GERD, the full picture includes belching, regurgitation, difficulty swallowing, excess mucus, and that worsening of symptoms when lying down at night. The lying down position matters because gravity is no longer helping keep stomach contents where they belong, and a valve that is already struggling to stay closed has even less support. Both conditions are typically treated with antacids or a class of drugs called proton pump inhibitors, which work by blocking the enzymes responsible for producing stomach acid. But here's where the engineering mindset becomes essential, because the treatments themselves deserve serious scrutiny. Antacids seem harmless on the surface. They neutralize acid and provide quick relief. But their side effects include constipation and, paradoxically, worsening acid reflux over time. Proton pump inhibitors go further by suppressing acid production at the enzymatic level, but they carry a heavier list of consequences. Constipation, excess gas, increased risk of stroke, vulnerability to infections like Clostridium difficile, heart palpitations, and elevated blood pressure are all documented side effects. There is also a condition called hypergastrinemia, which is an overproduction of gastrin, the hormone that signals the stomach to produce acid. When acid is suppressed artificially, the body compensates by producing more gastrin, which eventually drives more acid production. The very medication meant to reduce acid ends up triggering a mechanism that generates more of it. Beyond that, suppressing stomach acid interferes with the absorption of critical minerals like calcium and magnesium, which has downstream effects on bone density, muscle function, and overall metabolic health. Surgery exists as another option, where the valve is physically tightened, but the side effects of that procedure include the permanent inability to burp, increased gas accumulation in the digestive system, and often a continued reliance on the same antacids and proton pump inhibitors that were supposed to be avoided. None of these solutions address the origin of the problem. They manage it, suppress it, and sometimes amplify it. Here is the part that genuinely surprises most people. The reason that valve fails to close properly is not because there is too much acid in the stomach. It is because there is not enough. Low hydrochloric acid, also called hypochlorhydria, is the underlying driver of both GERD and LPR in the majority of cases. The stomach's acid concentration should sit between a pH of 1 and 3, making it one of the most acidic environments in the human body. When that concentration is at its proper level, the valve at the top of the stomach receives a signal to close tightly and securely. When acid levels drop, that signal weakens, the valve stays loose, and whatever acid remains begins to travel upward. So the burning sensation that feels like too much acid is actually the result of even a small amount of acid reaching places it was never meant to reach, because the door that should have kept it contained was left open. Taking antacids in this scenario is the equivalent of fixing a leaking pipe by removing all the water pressure. The leak might stop temporarily, but the underlying structural problem remains untouched. Hydrochloric acid in the stomach is not just about digestion. It is a cornerstone of the immune system. The stomach is designed to be almost completely sterile because that intense acidity kills pathogens that enter through food before they can travel further into the digestive tract. When acid levels are low, pathogens survive the stomach and move into the intestines, where they can cause infections, imbalances, and a condition called small intestinal bacterial overgrowth. Beyond immunity, hydrochloric acid is responsible for breaking down proteins completely. Incomplete protein digestion creates stress throughout the rest of the digestive system, forcing the pancreas and intestines to compensate with additional enzyme production. When this happens alongside intestinal inflammation and a compromised gut lining, partially digested proteins can pass through the intestinal wall directly into the bloodstream. The immune system, encountering these foreign protein fragments, begins producing antibodies against them. This is how food sensitivities develop. This is also one of the pathways through which autoimmune conditions begin. The third major role of hydrochloric acid is mineral absorption. Without the correct pH environment in the stomach, minerals like calcium, magnesium, potassium, zinc, and iodine cannot be properly absorbed. This explains why many people with chronic digestive issues also struggle with anemia and mineral deficiencies, despite eating what appears to be a nutritious diet. The acid also triggers the pancreas to release digestive enzymes and signals the gallbladder to release bile. When the stomach's pH is off, the entire digestive cascade is disrupted from the very first step. Once the root cause is understood, the solution becomes logical. The goal is to restore proper stomach acid levels, not suppress them further. The most effective way to begin this process is with betaine hydrochloride, a supplement that directly supports hydrochloric acid production. Taking between 3 to 7 capsules right before a meal can help restore the acid concentration needed to trigger proper valve closure and complete protein digestion. However, there is an important caveat. If the condition has progressed to the point of causing gastritis or an ulcer, the stomach lining is already inflamed and damaged. Adding betaine hydrochloride in that state will cause pain and worsen the inflammation. In that case, the priority is healing the stomach lining first, which can take between 2 and 3 months. Zinc carnosine is a well-supported option for that healing phase. Once the lining has recovered, betaine hydrochloride can be introduced gradually. Diet is equally important in this process. Grains are among the most significant contributors to the problem, despite being commonly recommended for acid reflux management. Grains contain compounds that promote inflammation, trigger immune sensitivity, and carry a ratio of omega-6 to omega-3 fatty acids that can be 20 to 1 or higher, flooding the system with pro-inflammatory signals. Animal products from grain-fed sources carry similar concerns, which is why grass-fed and pasture-raised options make a meaningful difference. Intermittent fasting is another powerful tool. Giving the digestive system a window of 16 to 18 hours without food allows it to rest, repair, and recover. Eating 5 or 6 small meals throughout the day keeps the digestive system in a constant state of activation, which prevents healing and perpetuates the cycle. A vegan diet, when constructed poorly with processed fake meats, soy protein isolates, refined grains, and added sugars, can accelerate digestive breakdown by removing the animal proteins and fats that trigger healthy acid production while simultaneously loading the system with inflammatory compounds. Done thoughtfully, a plant-based approach can work, but it requires careful attention to nutrient completeness and the avoidance of the processed substitutes that dominate mainstream vegan food culture. The chronic mucus in the throat, the coughing, the hoarseness, the lump that never seems to go away, all of it traces back to a stomach that is not acidic enough to do its job. Restoring that acid, healing the lining where necessary, removing inflammatory foods, and giving the digestive system time to recover are the steps that address the actual problem, rather than silencing the signals the body is sending. With that said, thanks for watching, and until next time.